Hi class, my name is Mackenzie and this presentation is on the urinary system with a focus on renal failure and dialysis. I chose this topic, or I chose to focus on renal failure as my disorder, also because I have 2 years of experience working in a dialysis clinic, so I use some of my experience as well as research to help with this presentation. So some of the major roles of the urinary system include filtering blood plasma, excreting metabolic waste and toxins, maintaining the blood pressure and pH balance, as well as regulating electrolyte and acid balance, and synthesizing vitamin D. Right here we have some of the major organs of the urinary system, which include the two kidneys, ureters, the urethra, and the urinary bladder. And right here we have the anatomy of the kidney. I just want to point out this renal artery right here and this renal vein. We'll be discussing that in the future slides, but just to let you know, like, these are two important factors, specifically with renal failure treatment. But we'll go ahead and discuss that in the future slides. So the kidneys also have endocrine functions. Some of this includes producing renin, and this happens in response to low blood pressure or low blood volume. This also impacts sodium levels and electrolyte balance. They also help with the formation of erythropoietin, which also helps with the red blood cells in bone marrow, and a receptor for hormones including ADH, aldosterone, and the parathyroid hormone. So they also help with cardiac output. It's the volume of blood that gets pumped by each cardiovascular ventricle per minute. So each healthy kidney receives the blood from the renal artery, which we saw in that previous slide of the structure. And that's then pumped from the abdominal aorta, but that exits through the renal vein. So on the structure, if we go back really quick, you can see right here, this is the renal vein, and this is the artery. So this is where the blood is being pumped in and exiting through the renal vein. Alrighty, so chronic kidney failure. This is the disorder. It starts off gradual, so it's a gradual loss of kidney function. Usually in the early stages, there's minimal symptoms. Due to lack of filtering toxins, a lot of patients will have high levels of fluid, electrolyte imbalance, and other waste. And because of this, it can actually be life-threatening. Unfortunately, there is no cure, but there is only lifelong treatment, which aims to slow down the loss of function of the kidney, while also functioning as a kidney by filtering toxins, electrolytes, and wastes. And in the next slide, we'll talk about the 5 stages of kidney failure or renal failure. So stage 1 is normal kidney function. Usually there's very minimal symptoms. One of the main symptoms is just urine output will be slightly decreased or starting to decrease. Same goes for stage 2. The kidney barely starts to reduce function. Blood pressures are usually kept an eye on around this stage. Could be an imbalance of blood pressure due to sodium imbalance and electrolyte imbalance as well. Stage 3 is moderate level. Stage 4 and 5 are severe. Stage 5 is end-stage renal failure. This is definitely treatments like dialysis are necessary to basically stay alive at this point. So acute and chronic renal failure. Acute is temporary. Usually this is more rare. This could be due to an infection. There have been times where bodybuilders have hurt their kidneys, and just a temporary acute kidney failure. Usually, it's usually hospitalization, hospital dialysis, a few weeks, and then they're fine. But chronic kidney failure is where it's lifelong. Some of these symptoms include, and this goes for both of them, but nausea, vomiting, edema, which is swelling caused by all this excess fluid that is not exiting the body. This can happen at the wrists, the hands, the feet. When I worked at a dialysis clinic, a lot of times we would notice when patients would come in fluid overload, a lot of their eye bags or their eyes were very, very puffy. Also, loss of appetite, less frequent urination, a lot of itchy, dry, flaky skin. This also happens because, unfortunately, a lot of patients that are on dialysis are also diabetic. Hypertension, and shortness of breath and chest pain. I want to point these out because these are also due to fluids building up in either the lungs or also the surrounding cardiovascular lining. and that's all because of the loss of kidney function. Some underlying conditions and other risk factors. So I just want to point out these ones right here, these top 4 that I starred. So diabetes, hypertension, and cardiovascular disease are the top leading causes and risk factors for renal failure. Drug abuse, abnormal kidney structure, inflammation of the glomeruli, and inflammation of the kidneys tubules are also reasons and other risk factors. However, they're not as common. Definitely diabetes, hypertension, and cardiovascular disease. And some potential complications of chronic kidney disease include fluid retention, which can lead to edema in arms, legs, face, high blood pressure, shortness of breath, as I mentioned before, from the fluid, basically the fluid drowning their lungs in a way. Hyperkalemia, this is high levels of potassium, which can cause nausea, weakness, and heart failure. This is also an example of an electrolyte disturbance or imbalance. High levels of phosphorus are dangerous because it can also create buildup, which leads to bone calcification and heart problems, and hardening of tissues. And this is also very dangerous too for patients who are diabetic, especially patients who are diabetic as well. And dialysis, we'll talk about dialysis in a minute, but it's also very important. Every week the patients get blood labs drawn and test their phosphorus levels, calcium, potassium, all because it's super important that they do not go super below or super above, as it's very dangerous for their kidneys. High levels of calcium can also lead to vascular calcification. And obviously, unfortunately, death. So if you're not getting treatment in your body, you're not releasing these toxins, everything's building up, that can lead to death. High levels of urea are just a waste product made of the proteins typically filtered at the glomerulus. The creatine is a protein produced by the muscular system that gets released into the blood. I'm sure a lot of you bodybuilders or those into fitness have heard of taking creatine. Uremia, set of complex systems caused by the kidney failure. So there's no specific symptoms, no specific, it's just complex issues that have been coincided with kidney failure. So treatment options, peritoneal dialysis is the first one. Hemodialysis is the main one. This is the primary one that most recommend. In clinic, at home, it can be done. Obviously, every patient wants a transplant. Unfortunately, there's a transplant list. There's a wait list. There's also, you have to meet certain requirements. You have to have certain health conditions. They take into account certain lifestyle factors, even if it was previous lifestyle factors. So it's not suitable for everyone, unfortunately. But hemodialysis is definitely there for those waiting on the transplant. And then dialysis treatment times just vary depending on the patient's body weight, height, and just how their blood gets filtered. So let's start off with peritoneal dialysis. So this can be done at home. The perks of this is that there's no needles, fewer medications. You'll have to do a treatment every day, 7 days a week, but it can be done any day of your, like any time during your schedule. So you can do it at night, in the morning, during sleep. So basically what happens is it uses the abdomen. So before starting treatment, the patient will go through surgery where this catheter, this like flexible catheter, is going to be placed in the peritoneum, and it's going to be used as a blood vessel, basically filtering the blood. So the catheter works as a tube, and it's going to absorb and discard the toxins, working as the basically as the renal vein. And then a fluid called dialysate will help cleanse the blood through the PD catheter. And this is also where it helps release all the toxins, electrolytes, fluids, wastes, minerals, and just functions pretty much as the kidney. And right here, if anyone is interested, there is a video link I have that discusses peritoneal dialysis. And here's a little diagram as well so you can see. Pretty simple. And then hemodialysis. So this is the kind of clinic I worked at down here. Here's also a video in case anyone wants to see. But as you can see, it uses this machine, and it does use 2 needles. So I'm so sorry about that. It uses 2 needles, and basically the needles will work as the renal vein and renal artery, as the renal artery will bring in the toxic filled, that that toxin-filled blood. The machine has this dialyzer, which pretty much acts as the kidney, filters all of that blood, all of those wastes, all of those toxins, and then it goes all the way back through into the renal vein. And so that's kind of what's going on in this picture here, and that video will also describe that. So as I mentioned, it uses the dialyzer, which serves as a artificial kidney. And then it's usually the patient will have a graft, which is like a bovine graft made out of cow, or a fistula. Usually it's placed by their bicep or in their forearm. Back in the day, they used to have them on their thighs. I haven't seen any of those. I know now they pretty much focus on the arm. Some patients will have to get multiple surgeries. Everybody is just so unique and different. But for the most part, the grafts are usually in the forearm, and the fistulas are usually in the bicep area of the arm. And so those 2 needles will go into that. And basically, as I mentioned, arterial brings out all that, toxin-filled blood, all that nasty blood, filters it through the dialyzer, and enters back into the renal vein. So at times a chest catheter is also used, and the chest catheter is usually used in the beginning when they're waiting for their access to heal, or in certain conditions if certain patients are too old or at risk for surgery, they will remain with the catheter. However, treatment times slow down with catheters, and there's a lot of issues, and you can't get them wet. So it is not recommended for long-term use, unfortunately. But with certain patients, they'll have a chest catheter forever. Just depends on the situation. And this one can be done in the clinic or at home. Usually, if it's done at home, you'll go through a training. It's usually in San Diego or LA, and they basically train you how to cannulate yourself, put the needles in yourself, how to clean up, how to do everything, what to look for, how to take care of your own body. And so it works good for the patients who have jobs and have active lifestyles. And treatment usually lasts 3 to 5 hours. Just depends, like I said, their body, their height, weight, and how fast it takes to clean their blood. And the last but not least, kidney transplant. So it only takes 1 working kidney, as we know. Original kidneys remain in place, and 1 transplant is added to the bladder. These typically last 12 to 15 years. However, there is always a chance of organ rejection. And in this case, it's back to dialysis. Transplant lists can take years. Like I said, they do take into consideration your health. You have to constantly do, heart checkups, heart monitors, your blood pressure, your labs, the dietitian, the physician. Everyone has to be on board and making sure you're going to be healthy enough for this transplant. Like I said, overall good health. And no other treatments are necessary if it is a success. The only thing is you will have to take daily medication and just constantly stay with checkups. But like I said, it only takes 1 working kidney. And then here's just a little picture. And this is the end of the presentation. Here's some other information if you guys want to check. Just some good resources regarding kidney failure. And then here's a works cited.